I am Dr. Adam, and with the Bright Minds at Adherence, we'd like to take you on a healthcare and wellness adventure with these two delightful helpers, Fizz and Emmy, and a team of specialists, Dr. Saul, the knowledgeable Dr. Aisha, and the professor with unparalleled medical expertise, Dr. John. We'll help the ill family who always think they're ill deal with the many health problems that come their way and learn a thing or two ourselves as we go along. Now, shall we get down to important matters? Because your health matters. At Adherence, we'd like to take you on a healthcare and wellness adventure with these two delightful helpers, Fizz and Emmy, and a team of specialists, Dr. Saul, the knowledgeable Dr. Aisha, and the professor with unparalleled medical expertise, Dr. John. We'll help the ill family who always think they're ill deal with the many health problems that come their way and learn a thing or two ourselves as we go along. Now, shall we get down to important matters? Because your health matters.
Dad, you have to see the doctor.
I don't have to do anything I don't want to. Free will! Listen here, Bluey. Leave me alone. Help! Nurse!
Dad, you're being dramatic, and that's coming from me!
Strap in, folks. This is gonna be fun.
So, Bill, what's all this about?
Nothing?
Don't listen to him. He stopped taking almost all of the medicines you prescribed him.
Well, that's good, no? It means I am feeling a lot better, and I don't need it anymore.
No, Will. That's not how these things work.
You tell him, Doc.
Will, you have to continue the medicines we prescribed you for the duration given.
But Doc, I was feeling better.
It's simple, Will. It's called medication adherence.
Wait, what?
Okay, let's explain it another way. The World Health Organization defines adherence as the degree to which a person's behavior corresponds with the agreed recommendations from a healthcare provider.
Excuse me, what?
Medication adherence
Yes?
is basically medication compliance, and it means to take the medication as prescribed by a healthcare professional. You know, the doctor.
See? It's important.
He said nothing about continuing.
Actually, that's called medication persistence, and that means taking it for the full length of prescription.
Oh, so what does this adherence look like?
There are 3 components to adherence. It starts off with initiation, which means taking the first dose.
Then there's implementation, which is when the actual dosing matches the prescribed dosing.
Then discontinuation, which marks the end of the treatment.
See, Dad? You haven't gotten to the 3rd step yet.
Well, I got nothing. I'm a non-adherer.
At least you know now, because this can come in many forms.
Wait, what?
It can start off as not refilling prescriptions, or worse, not even refilling the first prescription.
Then there's discontinuing the treatment before the end of the recommended course.
I got it, guys. Continue, please.
Taking more or less of the medication than what was prescribed, or not even taking a dose.
And finally, taking a dose at the wrong time.
These things can happen intentionally, but sometimes a person may face barriers to taking their medication correctly.
Yeah, for example, not understanding the treatment plan or being unable to pay for the treatment.
If it's a burden to some people, then why does this adherence thing matter at all?
Well, because there are a lot of complications that come with non-adherence.
You just had to ask. Tell us what they are, Doc.
For starters, the disease can progress and become more complicated.
It can even reduce your functional abilities and quality of life.
And other things like treatment failure, drug resistance, increased healthcare costs, and even death.
Death? Okay, now I want to know why people aren't adhering.
There are many factors contributing to non-adherence, such as patient factors, healthcare team and system-related factors, therapy-related factors, condition-related factors, and socioeconomic factors.
And that means... Break it down for us, Doc.
Patient-related factors include the patient's age if they're young or elderly. Also, There usually seems to be less adherence among men, a negative outlook or disbelief concerning the disease, or treatment doesn't help either.
Being poorly educated on the matter or lack of understanding of the disease or treatment could lead to poor adherence.
Psychosocial issues such as stress may also contribute.
Then you have the people that have poor access to healthcare facilities or have a poor relationship with their doctors.
It's a good thing I don't have that problem. Grateful for you guys.
Anyway, for therapy-related factors, some people find it difficult to stick to long-term medication, especially if the regimen is complex and includes multiple tablets and food or fluid intake specifications.
Condition-related factors can include people stopping treatment because the symptoms go away, the condition improves, or the severity of the pain reduces.
I said I'm sorry. I won't discontinue again.
No, Will, I know. I'm just explaining.
Oh, well, go on then.
Socioeconomic factors include no family or social support, low income and high medication costs, as well as lack of transport.
Aw, Dad, you know I always got you through thick and thin.
Oh, that means a lot, Bill. Bill, you're choking me.
Oh, sorry. So when is this really super important?
There are some chronic diseases that are affected by adherence. This includes asthma, where patients require regular preventative therapy, and multiple doses or inhaler devices.
Need to check if Phil is taking his medication regularly as prescribed.
Then there's depression, where patients often need prolonged treatment.
And diabetes, where patients need to regularly self-monitor their glucose levels and follow complex medication regimens and ensure controlled diet and regular exercise.
Okay, I see. Yeah, how do I make sure to get on and stay on this bandwagon, docs?
Well, the first thing is getting educated on the matter, like you just did.
Knew it!
So you gotta improve the understanding of the treatment and why it needs to be taken.
Your behavior towards the medication needs to improve, so you're willing to incorporate it into your everyday life. Use electronic reminders and even diaries and logs. You can also reward yourself when you follow through on the prescribed regimen.
I like the sound of that.
Then we need to address the necessary improvements in access to healthcare systems.
More appointments, adequate financial coverage, and greater continuity.
Information sharing between doctors and pharmacists, and greater communication between patients and doctors.
This is exactly why I have you on speed dial.
You what?
Yep. Now, Dad, let's get you home so we can work on your medication calendar.
Can we use some of Jill's highlighters?
Oh yeah, but don't tell her.
Definitely an interesting day when they're around.
No doubt. But as for you folks back home, ready for some fast facts? Globally, approximately half of the patients with chronic illnesses don't take their medications as prescribed. There are many consequences of non-adherence, and they include progression of the disease, reduced quality of life, and drug resistance. In the Middle East, up to 88% of patients with chronic illnesses are non-adherent to their medications. Interventions such as education and health literacy, improved behavior towards medication, and improved access to and quality of care all aid in improving medication adherence. Oh, and remember, your health matters. You can visit the below website to gain more information on health and wellness and access the Health Matters with Dr. Adams' series of videos. If you feel you need further healthcare and wellness information, you may consult with your family doctor.